For the first time in the pandemic, Clark County has set a record for the number of COVID patients in the hospital.
The governor's office says it's waiting for federal help and in the meantime asked nursing schools across Nevada to send their students to join the fight. More than 1,600 people are in beds across Clark County. The Nevada Hospital Association says hospitals are 98% full. Some overcapacity, the shortage of staff at crisis levels. Nurses and patients have told us it's so full. If you're not in dire straits, you may have to wait hours in a hallway for a bed.
The challenge right now is a sort of perfect storm of inadequate staffing levels and then surges in patients and percentages of COVID patients showing up in the ICU compared to Delta.
To keep people from the hospital, there are monoclonal antibodies at clinics across the valley, but in the valley and nationwide, there is a shortage. The hospitals say to help them, the best thing you can do to get the vaccine. Thousands of people with the vaccine are learning every day the Omicron variant can infect you, but doctors say the vaccine is keeping you out of the hospital and saving your life.
Vaccines, they're not intended to stop infection. They're intended to prevent you from getting severely ill.
As cases surge in the thousands across the valley every day, many people who need a PCR test or at-home COVID test are vaccinated. Doctors say the vaccines are still protecting you.
By getting fully vaccinated and boosted, it significantly reduces your likelihood of being hospitalized or dying.
The highly infectious Omicron variant, as infectious as the measles, can infect anyone, but doctors say those vaccinated or boosted have mild or flu-like symptoms and quickly recover. According to the latest Clark County data, more than 40% of all January cases are a breakthrough. But when you compare the breakthroughs to the numbers who did go to the hospital or die, the results are dramatic. 96% of those in the hospital not vaccinated. The vast majority of those who died in Clark County also had no vaccine. Those who did, mostly seniors or had underlying health conditions.
For people generally that aren't vaccinated, it still can cause a pretty severe illness.
Dr. Angie Hansberg, Division Chief of UNLV Pulmonary Critical Care, manages COVID-19 cases at UMC's ICU. She says it's a big misconception the Omicron variant is mild for everyone. She says, once again, the vast majority of patients in hospital beds are unvaccinated.
This isn't that surprising. It's sad for those who are so sick.
If you do test positive on an at-home COVID test, you can actually report the results to Clark County. It's right here. There's a form on the Health District website.